you said at the beginning that you want to take it back from those who've messed it up.
Yes.
So what has been messed up? And then, seeing what has spoiled, what then would you want to fix? Or how would you bring about any kind of change?
So there's so many things wrong with Machakos. Everything you see is a facade. So you have the place to be, which looks all very nice. You have all these nice flowers.
Public toilets.
No, actually the public toilets are locked in most markets, and they don't have water, and they don't have a plan to clean them. But the biggest telltale sign that things are broken in Machakos is the health system, starting all the way from Gateway Mall to the farthest corner of Machakos County. And the health system has completely collapsed irretrievably. You do not have medicine in any of the hospitals. You have ambulances that were probably public service vehicles for ferrying goods like potatoes and maize that were converted into medical vehicles. You have a situation where our medics are not treated well. You imagine a county of 1.4 million people, 85 medics, 25 of whom are on study leave. You know, the patient to doctor ratio is so skewed that in any permutation, people will not get any form of decent health care. And the revenue that we've been collecting as a county, this current county government you have out of a budget of 12 billion, close to 80% is recurrent expenditure. If you go to Machakos Level 5 hospital today, you will have to remove money from your own pocket to buy razor blades, to buy gloves, to buy syringes for injection. And if you really want the nurse to look after you, you better find a way of, appreciating them. Because their terms of service are terrible. The county government has not invested in the welfare of medical staff. You know, and that's where this whole journey starts. If you don't look after your medics, and it doesn't matter whether you're talking about specialist doctors, starting from community health workers, you know, the fight against COVID was led by community health workers, people who would go out and educate the public about wearing face masks, about washing hands, and things like that. We have 2,300 of them in Machakos that are now on the 10th month of not having been paid their stipends. You come into the hospital itself, clinical officers, lab technicians, doctors themselves, not getting adequate support in terms of allowances and stipends to work in areas that are quite remote in the county. Then you look at the arrangement, the supply chain for drugs to get into the hospitals. That has also collapsed. Then you look at the level 5 support that was given by the national government in terms of diagnostic equipment. So Machakos level 5 hospital has cutting edge MRI, cutting edge mammography, cutting edge CT scan, X-ray machines, you name it, the best of the best dialysis machines. None of those are in use.
Why?
Because the operating costs are to be met by the county government.
Yes.
Consumables are to be met by the county government. And there seems to be a coalition of the willing, I don't know how to describe it, where a patient will come in with an obvious broken limb, be given a prescription to go to the 2 private hospitals which are next door to get the X-ray.
And yet the hospital has the equipment.
Yes, not just the equipment, the best of breed equipment.
So where's the problem? Because, well, we can see these are the things that are not working. Let's just focus on health. What are the reasons why these things are not working? Yet there is money that comes to the county. There is money that's collected by the county. And you've told us 80% of this is going into recurrent expenditure, which includes purchasing the consumables and paying staff.
Electing politicians is the first problem. The second problem is delusions of grandeur. So governors get into office, ours in particular, and you feel that you are a president. I don't know where this impression comes in. You feel that you're so powerful that you now do not have a responsibility or accountability to the people. You now you're almost a law unto yourself. And this is the tragedy of devolution in a lot of the counties, because the governors don't see themselves as administrators. Administrative work requires you to be in the office in the morning, planning things, working with your team, making sure you have competent people at every point of inflection. So, who is your hospital administrator? Who is your health CEC? Who is your health chief officer? Are they ready to do this work? And are you motivating them? Are you holding them accountable? Are there performance contracts in place? What is a picture of success? We know what the picture of failure is because that's what we see everywhere. But what was the picture of success? And for me, the picture of success would be very simple. I'm not going to make big promises to the people of Machakos. I'll simply tell them, we will return medicine to the hospitals. We will restore the referral system so that when you go to a dispensary, the dispensary will cure you for what the dispensary can handle. When you go to level 3 facility, we will make sure you can be handled up till level 3. If you need a referral to level 4 and level 5, you follow. That way, we can plan our resources accordingly, distribute our doctors and medics accordingly, understand where we need outreach programs, because the county is quite vast. A lot of the community will never be able to make their way into hospitals. So having an effective community health volunteer system is mission critical